Meet Dave. Dave's 68, he just got home from Costco, and he's about to have the worst 10 minutes of his life. He's hauling a 12-pack of paper towels into the house when, out of absolutely nowhere, he feels like someone reached into his chest and yanked. Within a minute, that pain has moved. It's not just in his chest anymore. It's ripping through his upper back between his shoulder blades. And weirdly, his left leg feels off. Weak, like it's not fully listening to him. This is not a pulled muscle. This is not I overdid it with the paper towels. Somewhere inside Dave's body, the largest artery he owns may be splitting apart from the inside. In the next few minutes, you're going to learn what an aortic dissection is, the 3 warning signs almost everyone misses, and why waiting to feel a tearing sensation could be the most dangerous mistake you ever make. Quick note before we dive in, I'm a board-certified emergency medicine physician, and this channel is all about translating what I see every day in the ER into plain English. No jargon, just the stuff you actually need to know. If that sounds like something you'd find helpful, please like this video and subscribe. Here's the thing nobody tells you about your aorta. It's not just a big pipe. It's a pipe with layers. Kind of like a fire hose that's actually 3 hoses nested inside each other. The aorta is the biggest artery in your body. It comes straight off your heart and branches out to supply blood to your brain, your arms, your kidneys, your intestines, your spinal cord. Basically, the whole operation. When everything's working, blood flows through the middle layer like it's supposed to. An aortic dissection happens when a tear opens in the innermost layer of that wall and blood starts forcing its way between the layers instead of staying where it belongs. Now you've basically got 2 channels where there should only be 1, and that second channel is expanding, pushing the wall apart from the inside as it goes. Think of it like this. Imagine your garden hose sprung a leak on the inside lining, and instead of leaking outward, the water starts tunneling between the rubber layers of the hose itself, ballooning out as it travels. That's essentially what's happening inside Dave's chest right now, except the water is his own blood, and the hose is keeping him alive. Why does this matter so much? Because as that false channel expands, it can block blood flow to whatever branch arteries it crosses, which is exactly why Dave's leg went weak. It can also damage the valve right at the base of the heart, let blood pool dangerously around the heart itself, or worst case, blow straight through the outer wall of the artery, causing catastrophic internal bleeding. Doctors split these into 2 types based on where the split happens, and the location matters enormously. Type A involves the part of the aorta closest to the heart, the ascending aorta. This is the scarier of the 2, and it usually means emergency surgery right now, no negotiating. Type B starts further downstream, past the arteries feeding the arms and brain. An uncomplicated type B can sometimes be managed at first with aggressive blood pressure and heart rate control, rather than immediate surgery, though a stent or operation may still be needed if complications show up. To be clear, most people with chest or back pain do not have an aortic dissection. This is not about panicking every time you tweak your back lifting a couch. It's about knowing when a particular combination of symptoms deserves an immediate call to 911, because when this diagnosis is missed, the consequences escalate fast. Remember how I told you that waiting to feel a tearing sensation could be dangerous? That's because an aortic dissection doesn't always feel like tearing. Some people describe pressure, some describe burning, some describe symptoms that look a lot more like a stroke than a heart problem, sudden vision changes, trouble speaking, weakness on one side. If you're waiting around for the textbook ripping sensation, you might be waiting for a symptom that never shows up. So if the pain doesn't have to feel like tearing, what should actually make you worried? Here are the warning signs almost everyone misses. Sign 1. Pain that is sudden and severe from the very first second. Not a pain that builds over an hour, a pain that arrives like a light switch flipping on. It can show up in the chest, upper back, abdomen, neck, or even the jaw, and it can migrate as the dissection travels along the artery. Sign 2, and this is the one that trips people up. Symptoms from disrupted blood flow elsewhere in the body. Fainting or near fainting, new numbness or weakness, trouble speaking, sudden vision changes, difficulty walking, severe abdominal pain, or like Dave, a leg that suddenly feels cold, weak, or strangely numb. Sign 3, and honestly, the most important one. It's the combination that should scare you into action. Sudden chest or back pain showing up together with a neurologic symptom, a fainting spell, or a painful limb is exactly the pattern that should trigger an immediate 911 call. Add in shortness of breath, unequal pulses, or different blood pressure readings between arms, and this stops being wait-and-see territory entirely. So what should you do if you notice the signs? Call 911, not urgent care, not your primary care office's after-hours line, 911. Do not drive yourself. This sounds obvious until you're the one white-knuckling it through traffic, convinced you can just make it. People do this. It goes badly. Don't wait around to see if the pain passes. And don't try to self-diagnose whether it's a heart attack, a stroke, a pulled muscle, or a dissection. That distinction is exactly what the emergency team exists to make, quickly and with the right tools. Once you arrive in the emergency department, the team moves fast, and it's more coordinated than people think. They're immediately checking your heart rate and blood pressure, comparing pulses in both arms and legs, testing your neurologic function, and looking for any sign of internal bleeding or blocked blood flow. An EKG and blood work help rule out other causes, but the real answer comes from imaging. CT angiography is the go-to test in most emergency departments because it can show the location and extent of a dissection within minutes. While it's happening, IV medications are already going in to reduce the force of each heartbeat and bring blood pressure down, because every beat is pushing on that already damaged wall. Meanwhile, the team is on the phone with cardiothoracic or vascular surgery because minutes matter here. Dave's scan comes back type A. Because paramedics brought him straight in and the diagnosis was made quickly, the surgical team is already scrubbing in by the time his family arrives at the hospital. That head start, the one bought by calling 911 instead of waiting to see, is the difference this video is actually about. For Dave, recognizing this wasn't just ordinary chest pain and getting emergency help immediately was the difference between walking out of that hospital and not walking out at all. If this video helped you understand something you didn't before, drop a comment below. I genuinely read them. And if you want more plain English emergency medicine content, don't forget to like and subscribe. As always, stay prepared, not scared.